The nationwide engagement of the health sector by NASSIT is in continuation of the intersectorial collaboration and deliberations hinging on the challenges of compliance to the Social Security Scheme. Similar engagements have been done for the military and police forces, teachers, news outlets on the operative actions of the scheme. Mohamed Fuad Dabo says, gaps in members' contribution statement is the most frequent problem, whilst highlighting some of the problems encountered with the health sector.
872 health workers are currently paid below the minimum wage. Can you believe that? 872 health workers are currently paid below the minimum wage. Since NASSIT benefits are tied to the minimum wage, all contributions received below the minimum wage are considered as underpayment. Most health workers, particularly nurses, are engaged by different health centers on voluntary basis. They are, however, employed and approved by the government through the Ministry of Health and HRMO. There has always been a lag between the engagement and approval dates. Most of these workers have always given NASSIT their engagement date as employment date. This has led to gaps in their contribution history as the government starts paying for them after their approval. Also, for various reasons, the names of some workers are taken from the main voucher either when on study leave and placed on supplementary vouchers. Contributions are not paid for this category, which leads to gaps.
The Deputy Chief Medical Officer at the Health Ministry, Dr. Mustafa Kaba, pointed out that NASSIT is not just focusing on the insurance scheme of medical practitioners, but the health sector in general, as they recently supported the Health Summit at Bintumani and will collaborate to work on improving radiological services. However, he committed to ensuring that they address the gap of health workers discovered by NASSIT to be receiving below the minimum wage.
NASSIT scheme itself is a very, very good one, and it has been implemented for years in this country, and the Ministry of Health, providing one of the largest workforce in country, has been properly integrated at all stages as we move on. We're expecting a national social insurance scheme that really takes care of people when they go into pension, and the challenge usually people mention is that the take home is something we should really consider, that it should be able to be of a level at least that I'll be able to move around, provide food or maybe some housing.
One of the health workers, Fasia Mansare, who is a midwife, explains one of her challenges that the engagement has brought solution to.
I was working with two different organizations, the government and NGO. But at first they said, we did not aware about it. They said only government should contribute for us. But now, because of this presentation today, we understand that we both receive from the government or the private sector, whatever you are doing from any organization, they should contribute for us.
NASSIT will engage all health workers across the country on the scheme within the next 1 month. Salifu Cherno Kamar, AYV News.